So this is some suggestions you can do for maintenance and prevention long term, incorporating the tools that we've learned so far. So first thing, you can do the glides and extensions in the morning. You can do the glides during the midday, and you can do the prone lying and propping during the evening. This does not mean that you should sleep on your belly. It's best to sleep on your back or possibly your side, but the prone lying can be helpful just to augment against some of the daily activities that you're doing that are perpetuating this pain pattern. So the better you can do with integrating these with your normal routine, the better you'll be at this. I call this habit stacking. So you just know that you do the slide glides or the press ups or the extension exercises after a certain activity. So maybe it's after brushing your teeth. Maybe it's, whatever it may be. Maybe it's after lunch or after a meal. You can also set reminders for yourself. That can be helpful. And then it's good to track these things because sometimes we forget. So having, some way that you're tracking the amount that you're doing daily so that you don't forget, that can be really helpful as well. So, ergonomics play a big role in this, especially if you're an office worker and you're working at a desk. So you want a centered work surface. You want the monitor and keyboard to be directly in front of you. You want the center of the keyboard to be at this eye level. And you want to avoid prolonged sitting whenever possible. Take micro breaks, move around the office. And then if you start to notice that your posture is deteriorating, quickly correct your posture, do those slide glides, do the extension exercises, do whatever you can do to bring your posture back to its optimal position. So, as I said earlier, this pattern responds really quickly to these exercises. So you'll usually see a dramatic improvement within the first 2 to 3 days. If you're doing this consistently and frequently and you're not getting a full resolution after a week, consider getting a complete in-person evaluation. And successful treatment means that the pain has centralized and eventually a centralized pain will go away completely. That is the ultimate goal. And then you can start going back to the daily activities that you really want to be doing. So that's it for this particular pain pattern, the cross pattern pain. Thank you so much for watching. I hope that was helpful. If you have any questions, please leave them in the comments and we can get back to you to ensure that you got the information that you needed to get rid of your pain.